Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
One of the most interesting is seven simple ways to be happier each day. And of course, we know how to be happy, but uh, nothing wrong with being happier. And they mentioned seven things. First thing is to seek out whatever is awe-inspiring to you. Whatever is great and greatness seems great to you. That's what you seek out and emphasize. Second is to uh, emphasize gratefulness and gratitude, uh, being grateful and appreciating what wonderful things have happened to you is good for everyone's mental health. Third is to do something kind for someone else because that's good for you. It's in giving that you receive, it's in pardoning that you're pardoned. So uh, uh, giving of yourself is number three. Number four,
Yeah.
celebrate somebody else's joy. Somebody else who's had something wonderful, celebrate that with them. And that's good for you as well as it is for them. And then tune into what matters, uh, looking at the core values that you have and the character building things such as fairness and is emphasized. And then number six is reflect on what on the good that you can do to others. Uh, doing orienting yourself to helping others, which many of you do every day, and then uh, always be positive in spite of what happens, whether it's negative or whatever. Turn it into positive. There's always the thing. Count your blessings. See what God has done for you. It will surprise you what the Lord has done. And so, anyway, those are just seven ways. You may have your own ways to be happy. But anyway, I thought I'd share those and see what comments you might have. You're here.
Yeah. Darryl is sharing what God has done for him. Mhm.
No comments? Okay. Well, let's go ahead and do the number of articles that we have today. Oh, this is a tips for healthier eating, which we kind of have every time we meet, but this is based on a Washington Post article some time ago that we kind of looked at and shared these tips. Uh, s- Replacing fruit juices with smoothies is one of the healthier items where you eliminate you add fiber blending fruits and vegetables into a smoothie, which emphasizes the nutritious elements of the protein, vegetables, and the fruit. And this is especially when you use green vegetables like kale and spinach, are highly nutritious and allow something that might not be as tasty to you to become even more tasty. That's number one. Two, opt for healthier uh, proteins like fish or chicken rather than red meat. Trying to eliminate that because of the intake of fish or fat can help decrease the chances of getting colorectal cancer, which we become particularly concerned about in the younger uh, adult population. I was reading about a gentleman who died of metastatic colon cancer at the age of 30. So uh, that's one area that the avoidance of red meat is recommended. Third is to eat more fiber. And uh, you hear so much about that, it almost becomes nauseating to hear it again. But a healthy microbiome in the intestine improves overall health. And foods such as beans, lentils, and avocado, and fermented foods such as kimchi, sauerkraut, and yogurt are especially beneficial for strong bone. In the same vein, they also mention uh, dealing with probiotics as well. Then the fourth, limit ultra processed foods. And many foods are processed, but when you have to add sugar, salt, and fat and other chemicals, this makes them ultra processed. And good examples of things that we may love, but they're ultra processed are French fries, cookies, chicken nuggets, and they are linked to uh, chronic abdominal pain, constipation, and irritable bowel syndrome. And then fifth, choosing whole grains instead of uh, brown rice, instead of white rice, other fiber grains like quinoa and farro can help decrease the risk of colorectal cancer as well. And then something that most of us love to deal with, sugar sweetened drinks like sodas and juices, uh, high in calories and low in nutritional value. And the recommendation is to stay hydrated with water instead. Then they also recommend it for those who like yogurt. It has fewer carbohydrates and more protein than regular yogurt. And you can add flavor to it by mixing nuts, seeds, and fresh fruits. Then number eight, don't be afraid of eggs because uh, eggs have a healthy choice and provide a great source of protein. One egg a day may decrease the chance of getting heart disease. You see another article today that says eating uh, eggs, particularly because of the yolk, decreases the likelihood of dementia. So eggs can be good for you. Pass on processed meats such as bacon, smoked sausages, and cured hams, which it may taste well, but uh, may wreak havoc on your gut health. Uh, don't drink any alcohol. Of course, um, drinking alcohol, some say there is no safe amount of alcohol consumption. We know how it's related to cancer and brain and heart disease, but and some articles say that there is a safe amount of alcohol consumption, but most of the recent literature suggests that there isn't a safe amount of alcohol consumption. And then about sweets, eat similar, less frequent portions of your favorites. Try dark chocolate instead of milk chocolate and avoid sugar substitutes, which are associated with many health problems. So these are some of uh, healthy tip habits relative to eating that we share in this article. Any comments about this?
Um, John, can you go back up a little bit? I saw something I wanted to ask Dr. Callender about. I think it was go up a little further. Let me see. Lean. It was something about lean.
Oh, eggs, that was around number 8.
Oh, okay. Without, no, I thought it said lean something, and I
You thought
was,
it said what?
I thought it. Oh, here it is. Number 2. Lean fish. What fish is considered lean fish?
We're talking about salmon, tuna, sardines, mackerel.
Okay. All right.
I had a question about rice. Um, what's the deal? I thought rice was like international staple.
Brown rice is far better than white rice
And why is that?
because the white rice i- is ultra processed. It's kind of like with dark chocolate and milk chocolate. Darryl?
Yeah, white rice has much of the fiber removed, and so you're getting a sugar rush without the fiber to slow the absorption. And the choice between brown rice and black rice is better, has more fiber.
Is the flavor different as well?
Yes, black rice flavor is, they describe it as a little nuttier, a little more pungent. It's a little stronger flavor than brown rice.
Never heard of black rice.
Me either.
Delicious, delicious.
Any other comments? If not, we'll go to the next article. Oh, this is an article it'll take time to read, but this is updating everyone on xenotransplants. As you know, FDA has approved beginning xenotransplants this year. So this fall, you'll be reading more about uh, humans getting pig kidney transplants. And this talks about the way in which that has occurred and the way in which many places in the United States have centers where uh, pigs are developed and made germ-free and also created with the lack of alpha galactose, which is caused a lot of the hyperacute rejection that occurs after xenotransplants. So far, we've only had really two kidney xenotransplants that have lasted for any period of time. But the expectation is that uh, we'll do better as we do more pig kidney transplants. But we shall see. This big question, of course, is uh, how many people will be willing to uh, take a pig kidney transplant. So far, it's mostly people who have not been able to get human kidney transplants who get the pig kidney transplants because that's all they can get. And
Dr. Callender, is the immunosuppression pretty much the same, or is more needed or less needed?
it's pretty much the same.
Okay.
But as they have identified, combining the thymus, the pig thymus with the kidney, it is hoped that less immunosuppression will be necessary. But so far, that has not been proven. But that is the most recent update is to combine the pig kidney with the pig thymus to decrease the amount of immunosuppression. But that has not been done in enough cases to really
Okay.
substantiate. But right now it's the same immunosuppression.
Thank you.
But it's a long article, but it's an article worth reading to get an idea of the history of how it has come to being after having started in 1963 and then after HIV uh, completely stopping and now starting again. So it's a very, it also talks about the many problems associated with centers of doing xenotransplant. How Alabama was once one of the centers and they've had their own internal issues that have caused them to get out of the field. But so that NYU is the remaining center and Harvard are the two remaining centers that are doing the xenotransplants so far. But this is a good article to really update and put into perspective how pig kidney transplants are now the uh, xenotransplant of choice when you can't get a kidney from a human.
Aren't there multiple pig farms now throughout the country that are
That's what this
dedicated to
article. That's this article.
engineering?
Yeah,
Yeah,
this article
yeah,
talks about them
yep.
in
Mhm.
detail. Yeah,
It's amazing.
yeah, expensive also.
Mhm.
So anybody, if you take your time and want to really learn everything about xenotransplants, this is a good article to read. It's a little long, longer than most, but it's good to know.
This article was recommended by Mark Tatum.
What's that?
This article came from Mark Tatum.
Actually, this article came from me.
Oh, okay. Well, Mark sent it to me.
I sent it to you too. Right.
Okay.
Yeah. Because somebody else sent it to me, and so
Thank
so
you. I
it's
haven't.
it's a field that is beginning, so to speak, even though it began almost 60 years ago. It's been up and down, and so finally it's okay. Let's go to the next article, unless there's other question. This is we talked last week about the forever chemicals, along with the microplastics, which also seem to be forever chemicals, and how that we now have an association of the FAS with type 2 diabetes. Whether this is an association or cause and effect remain to be seen, but I think it's going to be us finding that these forever chemicals can be associated with many diseases that we can do without. And so we're going to have to find ways to break down these forever chemicals. We talked about the source of them with the those pans that we use that are stick proof and all the other, along with the microplastic. These are issues that are causing diseases that we're going to have to try to figure out how to eliminate them so they'll not be forever chemicals, which they are now. Dr. Perez?
Good morning,
Welcome back, by
family.
the way.
Good morning, family. Love so much the discussion, but I guess connecting this article with the previous article speaks to how important it is that we keep politics out of science as much as possible. Because I'm sure that lobbying removed regulations and constraints on industry, and that was influenced by politics.
Well, for the next 4 years, you can forget that.
That's why I'm saying we have got to continue to push to vote to assure that we get back to a humane level of dealing with the science.
The sooner the better.
Yes, and I'm just going to interject this one thing. Having just come through my third bout of COVID and appreciating that now Paxlovid, which is used for the treatment of COVID, is no longer covered by Medicare because of our secretary.
No longer.
So the copay for me was $700.
Wow. Mm, wow. And the worst is yet to come because doing away with Medicaid next year and other things in addition to the, what is it, 10,000 FDA, I mean, sorry, federal workers who are going to be without jobs. It's a tough 4 years ahead of us. Okay. Any other comments? If not, we'll move on to the next 4 years. Dr. Perez, you want to tell us anything important about the NMA that you want to share with us?
I thought it was a great meeting. It was real important to see the young people. Am I coming through okay?
Anything else you want to share with us?
It was a great meeting. We, as you said, these next 4 years, we have got to remain informed. Share this information that we're getting today with everybody that we know. And begin to only listen to trusted sources and take care of ourselves.
How long ago were you president of NMA?
Oh, so long ago, in 2001 to 2002.
Time flies, doesn't it?
Yep. Unequal treatment, confronting racial and ethnic healthcare disparities. And we're in a worse situation now than we were then.
Yeah. Okay, thank you for sharing. This is an article about mixing vitamins with coffee, which is an interesting article as well. And this shows you, as you go down the article, it shows you which vitamins you shouldn't mix with coffee. And it says it's consuming coffee within 2 hours of these vitamins is compromises the efficacy of the vitamins. Vitamin D, vitamin B, calcium, and it's one other. Yeah. It says you can do it, but you should take at least two hours between the time you take the vitamins and you take the coffee because it decreases the absorption of tea similarly, but the impact is not as profound as with coffee. That's something I was unaware of, but I'm not a big coffee drinker. But, any comments about this one?
Yes, Dr. Callender, I had heard that taking fruit juices or you using fruit juices instead of water to take your medicine was not a good idea. Have you ever heard that?
Well, somebody's on the phone and it can't.
Yeah,
couldn't hear what you said. Could you repeat it, please?
I said I had heard that using fruit juice or especially acid like orange juice or grapefruit juice.
Well, grapefruit juice.
To take your medicine.
Grapefruit juice is
medicine.
Grapefruit juice is notorious. Orange juice is not so bad, but grape juice is. Okay. I'm sorry, grapefruit juice.
Yeah.
Grapefruit juice.
Okay.
Is notorious for interfering with the absorption of medication.
Okay.
Not so much the orange juice, but grapefruit juice in particular is noted for that.
Yeah, I had heard it. I tried not to, but I noticed this morning I was drinking orange juice and I took my medicine. So
yeah, orange juice is not nearly as bad as grapefruit juice.
Okay.
For many medications.
Thank you.
Not all, but just some, especially the transplant medications.
Thank you. Thank you.
Janice, were you trying to say something?
No, I'm sorry. I can't really trolling. I'm trying to be quiet. I'm at the car dealership waiting for my car to be repaired. So I was
Oh.
trying to log on quietly. I hope I.
Okay, all right. Okay, well, let's go to the next article then. This is an interesting article because for decades now, we've required our patients to fast before they get blood work. But now, with the technology, no longer is it necessary to require fasting. So we can, uh, so that has now become old-fashioned. So whether you fast or not is no longer required. In the old days, you always had to fast before. But of course, now with hemoglobin A1C and LPAs, it doesn't matter because they uh, identify over a period of months whether or not your uh, blood sugar levels and cholesterol levels are okay. Okay, that's a boom because some people didn't like to fast before getting their blood and then forget to fast. Now you don't have to worry about that. Okay, let's go to the next article unless we have any comments.
Yeah, I asked Janice if she could mute her phone. See if Janice can mute her phone because it's still leaking over into the recording.
Okay. Now this is a article that shows that the GLP drug reduces mortality risk in patients with heart failure that's caused by obesity, which is one of the many things that GLP-1 drugs can be great at. Every week we're finding out new things that can be helped by the GLP-1 drugs. Um, so that even heart failure can be uh, treated and reduction of mortality risk. Patients with obesity-related heart failure occurs as a consequence of using this GLP-1 drug. And there's another one article that we may get to that shows that it also um, affects uh, idiopathic intracranial hypertension, but we'll come to that maybe. Okay. Um, Seems like every week there's some new positive finding about GLP-1 drugs as well as side effects as well. So as time goes on, we'll learn more and more about them. As Dr. President said earlier, this is an opportunity to learn a lot about these drugs, particularly as it relates to people of color. But so far, I haven't seen any evidence of that yet. It may be that the HBCUs are so battling for their lives so much so that they haven't had opportunities to do it yet. But hopefully we can not have to fight so much to continue uh, diversifying and deal with some other issues that are as important. Next article, please. This is an article. Yes.
One of the things that came back from the convention and scientific assembly at the NMA that was so heartfelt was the impact of pulling back our resources around the world. its impact on education, trust. You know, people have said that the impact of pulling these dollars back wouldn't be felt immediately, but we could hear how it was felt immediately.
Oh, yeah.
Scientists, practitioners that are here, physicians that are here that are afraid to go out of their homes because they can get picked up. I mean, it's unbelievable.
And the worst is yet to come.
Yes.
Yeah, you're right. It's not to speak of what's going to happen to the HBCU students who have grants. Yeah.
Yes.
Uh, anyway, this is the GLP drug that apparently is good for idiopathic intracranial hypertension, which is associated often with obesity and associated with headaches and uh, visual symptoms. And this, so in the past, has not been effectively treated, but now it appears that this is GLP-1 drugs can be treated with this medication effectively also. So let's go to the next article. Probably few of us ever heard of idiopathic intracranial hypertension anyway, but so it's kind of hard for institutions that are fighting for their lives to really try to do meaningful research when their grants are reduced or eliminated. So it's tough, tough times. Now, this is an article that talks about combining GLP agonists and bariatric surgery. Gives you even better long-term weight loss. Uh, this combination is thought to be the optimal combination for people who want to lose weight and sustain the weight loss. And so this is probably one of the first articles that has really looked at this combination and saying that together is better than either one alone. So it's going to be interesting as time goes on to see uh, how long-term these results can be with the GLP-1 combo, so to speak. Any comments on this article, which is the first of its kind? Yeah, and it shows the pictures of the different bypass procedures, and there are many. Ready, Blaylock?
Yes, Dr. Callender. Of course, my husband isn't getting by the surgery, but he does take one of the GLP-1 drugs for his diabetes. So, do you think just taking the drug would help his weight loss as far as
Yes, the answer would be yes. The GLP drugs actually are approved for diabetes, but they also are approved in some areas for obesity as well. So that one would expect you to have the benefits of both the diabetes and the obesity.
I'll keep my eye on his stomach.
So what I take?
You take the Jardiance. So yeah. Okay.
Okay. Next article then. Well, this is the article about the fact that actually 10,000 federal employees eventually likely to be fired as the Supreme Court has uh, gone along with Trump in terms of allowing them to proceed. Actually, they had cut back so that only about 3,000 has been fired so far. Another 7,000 remain to be fired as they continue to battle with the Supreme Court over whether or not the other 7,500 people will be fired. So my expectation is that Trump will win out and the whole 10,000 will wind up being fired. That's a lot of people. And as Lucy mentioned, that's just the impact in the United States. The impact, of course, in Africa is far more severe and more penetrating. And uh, most people have not even talked about the devastating impact this has had on the African countries. Nor the impact it's going to have on education down the road, particularly affecting people of color. Any comments about this? We're stuck with it, huh? Yeah. Good. Well, yeah. No additional comment is necessary. Darryl Armistead?
Yeah, I've really been impressed the years I've been on this group session about the number of cures that have uh, that have come forth in the medical community, and cutting back the funding and firing people in health and human services, cutbacks with the NIH. That seems like that's going to reduce the number of new cures coming forth, because NIH is probably foundational, does the foundational research. Private companies do the later development and commercialization after government has already stepped in and developed the cures. So
Thanks for
is
sharing.
that
That's so true.
am I understanding that correct? That we're probably going to be looking at fewer new cures coming out?
Yeah, I agree with you. Yeah, that's the expectation. Although we will see a communication from the new CDC person uh, uh, who thinks that they can be independent and helpful in that. But we shall see. Dr. Perez, and then John Buchanan.
And the issue of trust. I mean, who trusts us? To share research, we have taken those people who have had a focus, a love, a passion on science and caused them to go into the private sector. What? And this is globally. Who will collaborate with us? Knowing that such collaboration could be hijacked by the felon president of the United States?
John Buchanan.
Yes. So this is the opposite of making America healthy again. It's insanity. It's like double speak. It's like 1984, all over again. I mean, what they were forecasting way back then. What you see on the news media, what you hear from the government. You believed back then. Now it's hard to believe anything that you hear because uh, the reality is the opposite of what they're preaching.
Any other comments? If not, Joyce. Joyce.
She's still muted, Joyce.
This enforces the MOTAP logo. Love yourself, take care of yourself, because we're in such critical times.
So true, so true. Okay, well, let's go to the next article, which would have to be more positive than this.
Darryl's hands up.
Yeah, we're going to make America less healthy, but as part of the conservative agenda to create distrust in government and science. For example, if you don't trust what comes out of the EPA about environmental regulations, then if you don't trust it, you say there should be no regulations and companies should be free to pollute however they want, increases profits. Um,
And that's the most
there's
recent proclamation. As you
yeah,
said, that's the most recent proclamation that there's no requirement any longer.
yeah, and it's also revenge politics. COVID made Trump look bad at the end of his first term. So it was all those medical scientists with NIH that made him look bad. So they're going to be punished.
Are you trying to say he's that petty?
Yes.
Uh, okay. All right. Let's go to the next article unless there's more comment. Now, this is an interesting article from uh, that talks about aluminum exposure for vaccines that are given to children, newborn kids, and it shows that actually autism and the other autoimmune and neurodevelopmental disorders are not associated with the aluminum that is associated with vaccines. Although the Secretary of Health has made comments about uh, autism being associated with vaccines, so far none of the data has confirmed that. And this was a study to look particularly at aluminum absorbed vaccines, which are found in childhood, used in childhood, and none of the studies could find an association of autism with any of that. But this is what this huge study has been about, although it's in outside the United States. This is done in Denmark. So far, there's been very little data that supports the secretary's allegation that autism is associated with the vaccines.
Dr. Callender, aren't there many more uh, substances or elements in the vaccines that could be related to autism?
None so far that have been documented.
Dr. Callender, don't you think that part of the deal with autism is that now we're diagnosing it a whole lot earlier than we were 10, 15 years ago, 20 years ago? I don't think there were hardly any diagnosis of autism. Now we're recognizing it earlier in children. And I mean, we still don't really know the cause of it, but it's not that it's not that the disease is increasing. We're just more aware of it now than we were 20 years ago.
I think that's part of it. I think that's part of it. Yeah. Any other comments about this? Because this is the basis of some of the secretary's concern, which has not been substantiated by data.
No. In fact, it's the other way. Look at the outbreak of measles in Texas.
Yeah, well, the new CDC director that was put in place doesn't agree with the secretary about that either. So it's going to be interesting to see what actually happens. But they have beaucoup data now to address many of the concerns. And very few scientists agree with him. So it was interesting. And one of the congressional hearings, one of the uh, congressmen talked about how little regard they had for his knowledge, the secretary's knowledge of what's going on in health. Jochebed?
Yes, sir. Good morning, everybody. I, I wonder if at the end of Praise God, um, Trump's term and some of the secretaries will be divorced from us. Um, will things be corrected? I wonder if some of these things that he has erupted um, could be or would be
Well, you got to
corrected.
remember he's going for a third term.
Yeah, yeah,
So
yeah. Well, uh, God is still in charge. Uh, uh,
thank God,
but
yeah, that's true.
it's amazing at how one man who is ignorant about medicine, about uh, uh, humans, period. I just think it's awful that he would be allowed to carry out such damaging methods of
Well,
well,
we put him in power by overwhelming vote.
yeah,
Betty
yeah,
Blaylock?
Yes, commenting about what Jochebed just said, it really is not just the one man, because in Trump's prior term, he stacked the Supreme Court, he stacked the judges, and now when he goes to them with his crazy ideas, they go along with it. So he did it. I mean, it's the result of one man, but he's got so many other people in his pocket, so to speak.
It's the Republican agenda.
That is true.
It's the
so true.
Republican agenda. If you look at their agenda, as horrifying as it is the Republican agenda. So the Republicans, the only way to change this is to get the Republicans out of power. That
Yep,
means in the House and the Senate, as well as the president, change. This is an article on Kennedy rescinds endorsement for some flu vaccines, which nobody else has gone along with. But uh, if the vaccine contains thimerosal, thimer thimerosal, uh, he has not uh, in favor of it, although it's not linked to autism as he tries to allege it is. Uh, but anyway, this is a good example of what's in store for us. And the scientific bodies have not agreed with him in what he's done here, but he done it nonetheless. So this is what we're up against. Any comments? Okay, let's go to the next article. And this is the article in which Suzanne Monarez, who is now the head of CDC, made her comments about vaccines, fluoride, and other items. She's a PhD rather than an MD, but she's a scientist of long term who is highly regarded and respected by many, and who has not agreed with Kennedy on many items. So it's going to be interesting to see what happens as a consequence of this. union. But you can read here how she has uh, gone along with most of the scientists in terms of disagreeing with Kennedy on many of the ways he's talked about the measles vaccine and everything else. So we shall see. We talk about fluoride and drinking water, and there's a lot of discussion about that. But, there's so much fluoride in the toothpaste that whether it's in the water or not is not as critical. Any comments on this as we continue to read differences of opinion within the administration and outside of the administration?
Dr. Callender, who has the last word, the CDC director or Kennedy?
We shall see. We shall see. It's going to be interesting to watch.
Yes, it will.
See, he acted before because there was no CDC director. See, now there is a CDC director, so it'll be out of his hands, so to speak. So theoretically, we shall see, though. Go to the next article now. This is an article that shows that interstitial lung disease, which seems to be a genetic disease for the most part, is associated with an increased risk for lung cancer. It's certainly associated with it. It's not cause of it, but you see a 13-fold higher incidence of lung cancer with people with this disease. It's not very common, but it is evident throughout many families. And I think that because of the fact it's not that common, we don't really know about it. Actually, I've had a couple of my wife's family members who've had interstitial lung disease, which is fatal itself, but its association in Sweden with lung cancer is remarkable as well. We're talking about a number of studies that are done outside of the United States, which may or may not have relevance to a large number of people of color we have in the United States.
Dr.
Okay.
Callender, my mother was diagnosed with lung cancer. As a matter of fact, that's what helped her along to her cocoon. But um, it, there was one doctor she had that introduced the thought of ILD. And because of her age, it was decided, she was 94 at the time. They decided that there would be no investigation further into it. But one doctor was quite concerned about the interstitial lung disease situation with her. And it was relatively such a new finding and so forth. I think they just, and of course, she was a person of color, so um, they didn't investigate it any further. And I'm really surprised to read this. I was reading it the other day, uh, uh, and John sent it to us.
Well, it is of interest because there does seem to be some genetic association of interstitial lung disease in some families, whereas you don't find it in many families, you find it in some. And so uh, interstitial lung disease has its own risk of mortality and lethality. But uh, I think if it is in the family, it's a good idea to be sure that people have X-rays so that you can find out whether or not you actually have interstitial lung disease. But usually it manifests itself long before 90. Uh,
Yeah,
so
yeah,
that's the thing that makes it less likely, since your mother was 94, that people with interstitial lung disease usually manifested around 50, 60, and even 70, but certainly not as late as 90. Anybody else in the family have ILD, so to speak?
not that I'm aware of.
Okay. Well, then it probably is not ILD, but
Right.
that would be the way to find out. If nobody else has any lung disease, then it probably is not the
Yeah.
cause of the case.
I had an uncle that died from an asthmatic attack, but that was way back in the day when it was really a critical disease and they it didn't quite know how to treat. But he was an uncle that was on my father's side, sort of distant. But
Well,
anyway,
yeah.
yeah,
Well, asthma is uh, different, and it's cause of
yeah,
lethality in many families. Uh,
right.
and so I think it's important to keep in mind that it's not ILD, but it's a disease that affects a lot of our people of color more so than others.
Mm-hmm. Mm-hmm.
Okay, thank you for sharing. Okay, let's go to the next article then. This is an article that talks about other signs of blood clots. We know that you can have phlebitis in the lower extremity. We can have it in the upper extremity. As, for example, one of the basketball players, uh, Victor Adiamo, get his last name, who had a blood clot in his upper extremity. And sometimes it's associated with pain in the legs, and sometimes it breaks off from the legs and goes into the lungs and causes pulmonary embolism. So you can have calf pain, you can have shortness of breath, you can have chest pain. So those are just some of the was in and at the bottom of this article, it lists the 5 symptoms that go along with the solid sign of blood clots, and what they don't c- include, although they include shortness of breath, and they include as you keep going down, you'll see that talk about chest pain, heart rate, but they don't talk about the fact that sometimes the first sign can be pain in the calf, and uh, particularly when walking. And that's something that they don't have as a sign of a blood clot that they probably should have, is that often you can have swelling of the lower extremity or pain in the calf, which can sometimes be the first sign of thrombophlebitis, which later then breaks off as a blood clot to go to the lung and cause some of these other uh, tachypnea, fast breathing, chest pain, tachycardia, coughing up blood, and low blood pressure, fainting. And these are some of the signs that can warn you that you might have a blood clot. But the sign that they don't have that it should have is the fact that you can have swelling of the legs and you can have pain in the calf. That could be a warning sign. It causes a positive Holman sign, which can be an early sign of a blood clot as well, before it breaks off and goes into the lung. So it's just a good article to know about some of the ways in which a blood clot can manifest itself. Any comments or questions about this article? Betty Blaylock?
Yes, I had a aunt who died as a result of a blood clot. I can't remember whether she actually had broke her leg and was in a cast, but I
Yeah,
know it had something to do with her leg.
yeah,
And then she was home alone. And when they did find her, she was actually on the floor, probably trying to get to the phone or get to the door or something, but the clot had come from her leg.
yeah. That's the commonest source, and I think Dorothy Dandridge and some other people have similar ways of dying, starting with uh, problems with the legs or the feet, and wound up with blood clot that went to the lung and killed them. Yeah, that's why I mention, although they don't mention in this article, the importance of the lower legs and feet in terms of having symptoms related thereto, which can be one of the first signs of a blood clot in the lower extremity, which then breaks off and goes to the lung and would kill you. Yeah. Okay, any other comments? If not, we'll move on. This is an article that talks about electroconvulsive therapy is more effective for depression in older adults than in younger patients, pointing out that we have medications for younger people, but the ECT, as they call it, works best with older people, not so much with younger people. And this, of course, is again a study that's from Sweden and may not be as relevant here in the United States, but it's food for thought. Darryl?
Is this the same as the electric shock treatment that they
Yeah.
did in One Flew Over the Cuckoo's Nest?
Huh? Couldn't hear the last comment you made.
Yeah. Is this the same as the electroshock treatment that they did in One Flew Over the Cuckoo's Nest?
Yes, that's it. Same thing. Yeah. And they're just suggesting that it was more effective in older people than in young people. For a long time, they used it in all people, but it's lost its value in younger people. Any comments? If not, we'll go to Betty Blaylock.
Is there really a scientific reason for why it's works better with older people than younger people?
They didn't go into the detail on that in this article.
Yeah. Okay.
I suspect because they don't know.
Probably so. Okay.
This is, we talked about eating eggs weekly may lower the Alzheimer's risk by nearly 50%. And they talk particularly about the egg yolk, which some people find offensive because they think it raises the cholesterol level. Uh, and this association may or may not be cause related, but it's an observation that they have made that remains to be. This is a new study, and so it's going to be interesting to see if it is repeated. But this is an interesting finding for those who like eggs anyway. And they talk about the choline that is found in egg yolks as being the principal ingredient uh, in reducing the risk of Alzheimer's. Well, let's go to the next one unless there's some comments about it. Next slide. Now, this is an interesting article that points out if you got autism, about 1/3 of the admissions for adults with autism are for mental health issues, with schizophrenia being the largest, the commonest mental health issue that these people have. Haven't had much experience with autism and people of color. Have any of you have relatives with autism? Or the high rate of mental health hospitalizations is means that people with autism uh, have a special need to have psychiatric mental health professional help. John Buchanan?
I had a student or two over the years, I taught for 35 years, but I had one in particular who had autism. But, you know, it's hard to explain what it is. What is autism? What does it really mean?
Well, it manifests itself in so many ways. Some of the autistic people are geniuses and some are not. And I'm not sure how you make a diagnosis of autism, but I do know that when people or children do not advance according to the ages and are unable to speak and other mental manifestations, that they're often diagnosed as autism. And the precise diagnosis I'm not clear on, but it's food for thought. Dr. Perez?
We've become a lot better. We talk of autism as being on the spectrum. And so much of what we consider to be the spectrum is society's perspective on one's ability and attachment to different things. So I think the clarity and the distinctions that we are learning about autism and the spectrum is fed by diversity and inclusion culturally.
Thank you for sharing. As you mentioned, the spectrum is very wide, and some people who have autism are brilliant, and some are not. Uh, Darryl?
Yeah, just describing it generally, you could say social awkwardness um, is one of the descriptions of autism, and they say that prenatal exposure to air pollution or certain pesticides may create autism in a child, as well as other genetic factors. But as Dr. Callender says, the causes are not that well understood.
Thank you for sharing. Lucy, Dr. Perez?
Social awkwardness in 2025, that is really a loaded statement and very subjective as we talk about people and their friends.
Well, I think it begins with social awkwardness, but there are many ways of manifesting itself. And there have been a number of movies that have demonstrated people with different spec different diseases along the spectrum of autism, with some being extreme, with extreme manifestations of social awkwardness, as you would say, because most of them with autism have difficulty in social engagements. And I think there's so much that spectrum is wide. That's why you mentioned the spectrum of autism, because it can, in the old days, they used to just say you were mentally retarded. Now, of course, that's outdated. And so we have many, that spectrum is very large, from being slightly social awkward to being unable to interact with other people at all. Um, The Accountant is a movie that demonstrated uh, one of the spectrums of the autistic, and actually covered many of the uh, disease entities that go along with that spectrum of autism.
Dr. Kanjufu addressed this issue with the conspiracy to destroy Black boys. Not saying that any of this was specific towards autism, but the subjective perspective that a diagnostician might have on a subject or patient could significantly alter the appropriate trajectory for that individual. So would and I'm thinking of Emmett Till, have a perspective or a social awkwardness and south of the Mason-Dixon line.
But that's not social awkwardness.
I understand, but that's because of your perspective.
It has nothing to do with perspective. That's racism, period.
Oh, okay. All right. Well, it's still in medicine.
Well, Emmett Till is not social awkwardness. That's just racism. I mean, to call that social awkwardness is to me it's serious error, because that's not so. That's just racism. Benny Blaylock?
Yes, this kind of reminds me of what I was talking about a couple of weeks ago with the system now in the school system, where they put children into a different track, sort of separate them, and without really having a medical diagnosis of what is going on, but they like separate them out of the norm. And so it gives them less ability to get the schooling that really is needed.
Well, of course, some would argue that's the reason for them to separate them, because they may need mental health professionals to help them. But the problem was that when they separated them, they didn't do anything with them.
No, that's true.
That's
That's
the problem. It's not so much that they are separated, but you separate them and then deal with them individually. That's one thing. But
do that.
to just separate them and just keep them away from knowledge, that's awesome. And that's what happened in what you described. And that's the biggest problem with issues like that, is if you separate them and then do nothing with them, then what have you accomplished? except made them socially as
More
as,
so.
yeah, uh, as you had mentioned, socially awkward. They would be very awkward and become more so as time goes on. And that was one of the problems with what they did, because they didn't really help those people. They just ostracized them.
True.
Okay, any other comments? If not, we'll go to the next article.
Darryl has a
Yep.
comment.
I have
Darryl,
a
you had something
comment.
else to say?
Yeah, autism stats. Whites are diagnosed 2.7%, Hispanics 3.3%, blacks 3.7%, which is 37% higher than whites. Asian and Pacific Islanders 3.8%, slightly higher than blacks. American Indian and Alaska Native 3.8%, slightly higher than blacks. So while we're as one of the major groups diagnosed at a higher rate, we generally have delayed diagnosis and intervention, particularly for black boys. So we're diagnosed with autism at older ages than white children, where the delay means that black boys miss out on crucial early intervention services.
Thank you for sharing. Okay.
I also wanted to add, I put it in the chat that the movie Rain Man is about a gentleman with autism, but he was a genius level at the same time.
Yeah. Yeah, just like the guy in the Beautiful Mind. Yeah. Okay.
One of my favorite movies.
Let's go to the next article. Now, this is a kind of scary article in the sense that this is a drug, gabapentin, that is used by many people who have low back pain. And this is the first description I've ever seen of the fact that gabapentin is associated with cognitive decline and dementia. And that still remains an unclear association, but it's an association that is becoming a great concern because it's a very commonly used drug. And so it's going to be interesting to see how many studies confirm this association because whether this is just an association or a cause and effect is something that becomes very important because there are few drugs that are as widely used as the gabapentin. Betty Blaylock?
Yes. My husband takes it, but also looking at the bottom of this is saying the non-elderly. My grandson also takes gabapentin, and I have been noticing that lately he forgets a lot. You know, I'm just more so than he's only 29, and more so than I think he should be forgetting things. He forgets a lot. So I don't know whether it has anything to do with this gabapentin, but he is on it. So I might
Does he have back pain?
his legs. That's what
Yeah.
he's taking it for. So is my husband for his legs. But
Okay.
I don't know.
Well, so far, it's just the first article I've seen that it has this association, so we shall see.
Yeah.
And this was a retrospective study, so it already is suspect. You need to have a prospective study. But when you have numbers like 26,000, discuss it with his doctor.
Yeah, I'm gonna see if he can ask his doctor some questions. Where's my internet?
Pearl Lipscomb, you had a question? Pearl Lipscomb.
Unmute.
Pearl. Well, while we're waiting for Pearl, this is an interesting study that said that you don't need to do 10,000 daily steps. You can do 5 to 7,000 or anything above 2,000 steps. And not that 10,000 steps is bad. It's just that you don't have to do 10,000 to really get the health benefits of walking and taking steps. So those of you who have less than 10,000, you're still okay. And they say the sweet spot is 5,000 to 7,000 steps. So take notice. I've never done steps. So any of you doing steps? Counting your steps?
I did when I couldn't swim anymore, when they shut the swimming pools down. I got up to probably 1,500. I mean, 15,000 several times. But I don't know. It wasn't really steps, it was miles. So I was up to 7 or 8 miles a couple times.
Pearl Lipscomb, can you unmute yourself?
Yeah, Dr. Callender, I was calling my sister because I know she's been having computer problems. And she said that she wanted to make a statement about the gabapentin. She has a daughter that's a pharmacist. And she said when she mentioned to her daughter that had been described gabapentin, she said the first thing her daughter said was, please don't take it.
Well, anyway, it's an association right now. They haven't confirmed it, but it's a common drug. It's used for different types of neuropathies and leg pain, back pain. It's one of the commonest drugs there is. And so, but to be aware of this association is important.
Yeah. And she said that's what
Good
her
advice.
I had a question about the same thing. I was told that gabapentin and pregabalin have similar uses. However, one is for the younger generation and one is better for the older generation. Had you heard anything about that?
No, I have not. I certainly have had more complications with swelling from the other uh, drug, but I had not heard any age discrimination, any age differences in the past. But we'll learn a lot because this is going to cause a lot of focus on gabapentin. Let's go to the next article then. Probably be the last article then. This is this is a very important article because the Trump administration now has focused on decreasing the amount of payment that doctors get, the amount of payment that specialists get from Medicare and Medicaid. And in the past, surgeons and other specialists make more money than generalists. And the Republican administration is now trying to change it around so that the journalists make more and the specialists, the surgeons, and people like that get less. So this is something that's happening as we speak. And this is going to impact all specialists as their fees are reduced and the generalists uh, are increased. Any comment about this? This is a very important change that is occurring that Secretary of Health is pushing forward.
What's the um I'm trying to say why was this started? What was the impetus for this whole change?
The impetus is that surgeons and specialists make more money than any other doctors,
But
and
they have
they
more
want
education.
the, uh, let me finish answering the question. They so that they want to get to the point where the generalists make as much money as the surgeons or more money than the surgeons. Uh, why they want to uh, do this is because they feel that specialists have more of an advantage. Of course, they also train longer than the generalists, but the impetus was to reduce the specialists' income. Frankly, that was the impetus. Regardless of the fact that they uh, spend more time in residency and all that stuff, they felt that the surgeons shouldn't be making so much money, and the specialists make so much money, and the generalists making uh, half as much as they make. That's the impetus. Tragic, but that's the impetus nonetheless.
Thank you.
Yeah. Hey, we're moving in strange directions for reasons that seem to be frankly ambiguous. But uh, they're moving nonetheless. So that right now the surgeons and specialists make more money than the generalists, and they're trying to change that.
Supply and demand, greed.
Come in.
Yeah.
Come in.
Well, okay, it's 10:30, so I guess that'll be the last article of the day. Betty Block, you had a question, comment?
Yes. Before you go, I just wanted to ask a question about I was scrolling down some stuff on my phone and I ran into something where they were doing a new treatment for oral treatment for COVID. They're doing testing. Have you heard anything about that?
About doing testing for COVID?
Oral, instead of a vaccination, and some type of oral treatment.
Uh, they've always had an oral treatment for COVID. It's not
Oh,
new
okay.
for treatment yet. That's what Dr. Perez was talking about.
Oh, okay. All right,
Yeah,
because
that's what she was taking because she had COVID for the third time. But there's always
ah,
been an oral treatment
okay.
for
They
COVID.
would, I'll have to delve into it. I'm gonna call them because they're
Yeah,
doing
it's
some
been
kind
around for a couple of years now.
okay, because they're doing some kind of study. So maybe I'll have more information about
And actually, one of the articles that we also included uh, identified a new gene that they thought was related to long COVID and would help in the diagnosis of it. But the Paxlovid, the treatment for oral treatment for COVID, has been around for quite a while. I think Trump had it.
Yeah, yeah. So I'm just thinking maybe this is a new treatment that they're studying. I don't know.
Maybe so, but Paxlovid has been around
Yeah, I've heard
for
of
several
Paxlovid.
years.
Yeah, yeah. Uh,
Okay.
I'll read up on it maybe at the next session after you come back.
Right. Okay.
So,
So